Hospitals not following the law. The price transparency requirements being ignored, leaving San Diegans with shockingly high hospital bills.
We have certainly had kids sick enough to be on ventilators in the intensive care unit.
COVID cases surging among children, what that means just weeks before schools reopen. And dramatic video of a local deputy being overcome by fentanyl during a traffic stop.
ABC 10 News at 6 starts now.
The vast majority of hospitals aren't following the law when it comes to being transparent about their prices. Good evening. I'm Kimberly Hunt. Steve has the night off. ABC 10 News anchor Derek Stahl goes in depth on a new report that found nearly 95% of hospitals aren't giving you the required information up front.
I actually have really bad allergies to tree nuts.
20-year-old Mason Kochel went to a hospital in January for a severe allergy. When it was time to leave, they handed him an EpiPen to take home, just in case.
Probably like 2 months later, you get the medical bill and I see there's a $15,000 charge on there for an epidural pen, which is extremely outrageous.
$15,043 to be exact. After insurance, he was responsible for nearly $4,000. But get this, we found the exact same EpiPen at a pharmacy costs about $350 for a 2-pack.
Obviously, if I knew that they were going to be charging me $15,000 for an EpiPen, I would have told that nurse, don't give me that. I don't want that.
Surprise medical bills like that one are one of the reasons the federal government rolled out new price transparency rules, which took effect this year. Hospitals are now required to publish a long list of pricing information online, broken down by each insurance plan.
For the first time, we have the right to know prices in healthcare before we get care.
Cynthia Fisher of the nonprofit Patient Rights Advocate says all this data may look confusing to the average consumer, but it'll soon allow tech companies to come in and do the work for us. Imagine shopping for healthcare like you shop on Hotels.com or Expedia.
We should easily be able to go to a search engine and find the price of an MRI at any hospital within a 50-mile radius, right?
But here's the problem. Patient Rights Advocate just surveyed 500 hospitals around the country and found just 5% were complying with the new rules. We asked them to check several California hospitals for us. The 4 largest hospitals in San Diego all show some pricing information, but Patient Rights Advocate found none of them showed the cost of every service for every insurance plan they accept, making them all out of compliance. At UCSD's Jacobs Medical Center, the price of many procedures is listed as variable. UCSD sent us a statement explaining why some of the prices are listed as variable, but it maintains what it's doing is consistent with federal guidelines.
This is the law. If you, Derek, can't go in and see your plan and see the exact price you would pay, they're not compliant.
Hospitals that are out of compliance can be fined up to $300 a day, but President Biden announced plans to make them even stiffer, proposing fines up to $5,500 a day starting next year. Patient Rights Advocate also checked hospitals in Santa Barbara and Bakersfield for us and found they too were out of compliance. When we alerted Dignity Health Memorial Hospital in Bakersfield about the findings, they responded with action. Quote, "We are now working as quickly as possible to fully comply with the complex regulatory requirements," adding, "We expect to begin posting this information over the next several months." As for Mason,
thank God that they had their hospital prices posted.
Patient Rights Advocate helped him get that $15,000 EpiPen charge dropped. It turned out to be a coding error, but they only found it because all the prices were posted online. Derek Stahl, ABC 10 News.
All of the hospitals that we mentioned gave us responses. Kaiser disputed the findings, saying that certain requirements don't apply to them because they operate differently. We put all of those statements on 10news.com. Speaking of hospitals, California is now requiring all workers in healthcare settings be fully vaccinated by the end of September. The Department of Public Health made that announcement today. The order includes workers in hospitals, nursing facilities, and most care centers. Visitors must also either be vaccinated or test negative within 3 days of their indoor visit. The county reported another 1,100 cases today, while our most recent test positivity rate rose to 7.7%. The local death toll from COVID went up by 1. More than 90% of the COVID cases here in San Diego are among the unvaccinated, but the number of cases among the fully vaccinated is rising. Suzanne Hoyam and her husband were both vaccinated in April, but after recently feeling under the weather and lightheaded, she decided to get a test. It came back positive, and her husband caught the virus as well. Fortunately, their symptoms were mild and they didn't need medical attention.
I really feel grateful that I'm vaccinated. I'm so grateful that my symptoms are minimal. Like, I really do feel like the only reason why I'm, walking and talking and standing here is because I'm vaccinated.
Medical experts say cases like Hoyam show that despite infection, the vaccines are working to protect against death and hospitalizations. There have been nearly 3,000 so-called breakthrough cases in San Diego. A popular Bankers Hill restaurant is now requiring customers show proof of vaccination. Jimmy Carter's Mexican Cafe on Fifth Avenue is making people prove they're vaccinated to eat inside. Anyone without proof can still eat in the restaurant's temporary outdoor patio on Spruce Street. In a social media post, owner Jimmy Carter says that he's also requiring all of his employees be vaccinated. And Palm Springs is now requiring people show proof of vaccination or a negative COVID test to eat indoors at bars and restaurants. The same holds true for large-scale ticketed events there. The Palm Springs City Council passed these new rules unanimously, along with an indoor mask mandate for all businesses. COVID cases in children jumped more than 80% last week. The news comes as schools get ready to head back to in-person learning. ABC 10 News reporter Adam Rakusin looks at what the case surge could mean for schools in San Diego.
Across San Diego County, students are either back in school or just weeks away from returning to in-person learning. That return coming on the heels of rising COVID-19 cases in kids across the country.
We're seeing increased cases, we're seeing increased spread.
According to the American Academy of Pediatrics, after declining in early summer, child cases have steadily increased in July. The AAP saying almost 72,000 cases were added the past week, a substantial increase from the prior week when about 39,000 cases were reported. Local numbers show an increase of cases for people under the age of 18. Dr. Mark Sawyer is a pediatric infectious disease specialist at Rady Children's Hospital.
We will see some kids who get COVID in school. I think that's inevitable, but I think the number can be cut down if kids all wear masks.
The Sweetwater Union High School District went back to school last month. According to the district's reopening dashboard, out of the more than 35,000 students enrolled in in-person classes, 90 have tested positive in July and August.
Of course, we're very concerned about all of our students and for our younger students who were not yet protected through a vaccine.
Richard Barrera is the board president for the San Diego Unified School District. They head back at the end of the month and are expecting more than 90% of students to be on campus.
Most importantly for parents, it will be safe for your students to be back on our campuses.
Barrera says the district will lean on the mitigation strategies they've already implemented, plus some new ones, including testing and vaccinations.
Everybody will be wearing masks. Everybody will be tested on a regular basis. Our classrooms are properly ventilated, which is an incredibly important way to combat the virus.
Adam Rakusin, ABC 10 News.
Dr. Sawyer says that they've seen other respiratory viruses this summer in addition to COVID. He says if your child is showing symptoms and you don't know the cause, get a COVID test to be sure. You can stay on top of any new developments with coronavirus by downloading the 10 News app. A free version is available in the App Store. Crews made quick work of a 1-acre fire in Balboa Park. It broke out just before 1 near the Balboa Tennis Club off Morley Drive. No one was hurt, no structures burned, and the cause is under investigation. The raging wildfire sweeping through a Northern California mountain town is now the 6th largest in state history. The 3-week-old Dixie Fire gained strength last night as it tore through the historic town of Greenville. The fire, which has burned more than 500 square miles, has already burned dozens of homes. CAL FIRE crews from San Diego are helping battle the flames.
So as soon as they get to the Dixie Fire, they're assigned a division and they're immediately engaged in either suppression activities, home defense, any of the assignments that they're typically given, but on a larger scale.
The crews sent up north are being replaced in San Diego County just in case a big fire erupts down here. The San Diego Symphony's Rady Shell Amphitheater is finally ready to open to the public. Today, they cut the ribbon, officially opening the 10,000-seat venue next to San Diego Bay. The opening was delayed due to the pandemic, but now it's ready for performances ranging from Gladys Knight to Jason Mraz. Jazz curator Gilbert Castellanos says that this venue is special.
Look at the view, look at the environment that you're in. It's just astonishing. And not only that, but this is like the state-of-the-art sound system. So it just sounds like, when I play the trumpet, so when I'm playing in this environment, you can really create the natural sound of the instrument, which is really hard to do in a lot of venues.
The shell also has walls that are a blank slate that have 3,200 lights for displays. Most concerts will be set up for an audience of 3,500. During times when no shows are scheduled, the venue will be a park that anyone can enjoy.